Let's talk about some common mistakes that are made in the management or treatment of asthma. Let's talk about mistakes often made by doctors, and that is to not recognize asthma for what it is, keep diagnosing bronchitis and giving one course of antibiotics after the other, and wondering why the child or the adult never gets better. Very common mistake. And doctors need to ask themselves, whenever a patient comes with a cough, especially if they keep coming back with a cough, can this be asthma? And then they need to undertake these appropriate tests, which may even include a trial of treatment. So you might assume, you know what, I think this could be asthma. I want you to try asthma treatment. Come back and see me, and let's talk about whether it made any difference. A second common mistake is for asthmatics or chemists to keep on using asthma rescue medication only. You know, those little inhalers or nebulizers that when the individual is coughing and wheezing, they use. They work very quickly, and the cough and the wheeze can subside. But a few hours later, it's back again. And the child's had to be given a bronchodilator 3 times every night. Can you imagine what it does to their sleep? It also doesn't get to the basic problem of the airway. And if that mistake is made month after month, year after year, those airways can undergo permanent damage and irreversible narrowing. In the treatment of asthma is to get the person onto the appropriate anti-inflammatory medication, because asthma, depending on the angle that you look at it from a pathologist's point of view, is an inflammatory disease of the airways. They're little inflammatory cells called eosinophils and others that have infiltrated. They react to things in the environment. They cause the airway to close down. What you need to do is chase those inflammatory cells out of the airway using appropriate anti-inflammatory medication. So any patient that finds that they're having to use a bronchodilator or a nebulizer repeatedly needs to say to themselves, I'm not managing my asthma correctly. I need to get to my doctor, tap him on the shoulder and say, is there not a better way to manage my asthma? And there is.